Hi, my name's Angie. I'm a student nurse. Can I do your head to toe assessment?
Of course. Do what you need.
Okay, I'm gonna shut the door. I'm gonna provide privacy. I'm going to wash my hands and put on my gloves. Can you give me your name and date of birth?
Susie. Jim Bob.
And your date of birth?
May 5th, 72.
And can you tell me what brings you into the hospital?
I just wasn't feeling right. A little dizzy, lightheaded.
Okay. So the whole time I'm gonna come in and assess her. I'm gonna be looking for bruising, how her skin looks. I'm gonna be looking for hydration levels and overall her cognitive abilities and any tape that needs to be removed or tubing that is attached to her, like a catheter, IV. Do you know what month it is?
March.
March, okay. And I'm gonna start at the top of your head and go to the bottom of your toes. Do I have permission to touch you?
Yes.
Okay. So I'm gonna start out and check her hair and her scalp. Feeling, looking for anything abnormal. I'm going to use my pen light. I'm gonna check her ears and behind. Check this ear and behind. That looks great. And then I'm gonna check your eyes. So I'm gonna come at the side, in, be sure that her eyes are clear. They're lateral, round, radiant. And then I'm gonna check her nares. I'm gonna occlude one side. Can you breathe for me? And the other, okay? And then can you open up your mouth for me? And do you have any broken or missing teeth?
Missing teeth, yes.
Okay.
Nothing broken.
Okay. The inside of her mouth looks good. I'm going to check her trachea, which is midline, and check for any lumps or bumps. And then one at a time, I'm gonna check her pulse on her carotid artery. Being sure not to do both at the same time. And then I'm going to pull down her sheet and listen to her heart sounds. So I will do 1, 2, 3, 4, and 5. Using the back of my hand if I have to move her breast to the side. And then is it okay if I go ahead and listen to your heart?
Mm-hmm.
Okay. So I'm gonna start out 1, 2, 3, 4, 5, 6, 7, 8. And have you had any chest pain?
No chest pain.
Okay, and then is it okay if I palpate your abdomen and listen to your abdomen sounds? So I'm gonna start with the abdomen in her lower right quadrant. I'm gonna move up to her upper right quadrant, her left upper quadrant, and her left lower quadrant. I'm gonna be sure to listen first and then apply gentle pressure after. When was your last bowel movement?
Yesterday.
Okay, and is that normal for you?
Yes.
Okay, so I'm gonna listen, 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 and listen for bowel sounds, which she's positive for. And then I'm gonna gently press. Does that hurt at all?
No.
Okay, so everything looks good up here. Is it okay if I lift up the sheets down at the bottom?
Yes.
So I'm gonna assess her feet. I'm gonna look at her toenails, which look good. I'm gonna check the bottoms of her heels for any pressure sores. I'm gonna check for any edema in her feet and swelling. Her legs look great. She does not have a catheter. I'm gonna check her pedal pulse, which is strong, so I don't need to move upwards. I'm gonna be careful to lightly place the blanket over her. And then I'm gonna come up and I'm going to assess her pulses on her hand, her radial pulses. And then, can you squeeze my fingers? And one thing that I had forgotten to do was to check the push-pull with your feet. So can you push against? And then pull up towards your head? Okay, great. And then is it okay if I raise the head of your bed?
Mm-hmm.
Are you having any pain today?
No.
And before I had started, I assumed that her vitals had all been checked. I'm gonna check both her arms, be sure those look good. Looks good. And then I'm gonna also check and tent her skin to look for, see if it tents or falls, and it doesn't, so she is hydrated accurately. And then can I lean you forward and listen to your back?
Yes.
And I'm gonna have you take a few deep breaths for me. I'm gonna check 1, 2, 3, 4, 5, 6, 7, 8. And then if I hear any diminished sounds or any, I'm not hearing anything, I will recheck again. Okay, I'm gonna go ahead and check how her back looks. I'm gonna check her bottom for sores. Everything looks good. And can I roll you to your side just a little bit so I can check? Okay, thank you. She looks great. All right, is there anything I can get you?
Nope.
I'm gonna return the bed back down to the lowest position before I leave her. Here's your nurse call light. And I'm gonna go ahead and take my gloves off. I'm gonna wash my hands thoroughly. I'm gonna open up the curtain and see my way out and document everything that I found.